Good afternoon, and thank you once again for the opportunity to bring you our COVID-19 update for July 17th, 2020. As usual, I have several guests that we've invited to not only listen to the information that we're sharing about COVID-19, but also to share other relevant information with the community at large. And today I'm very proud to announce that Dr. Walker's rejoining us, so I'm certain that he'll have very relevant, up-to-date information relative to specific stats as it goes with the COVID-19. But also, we have Lisa Doherty, who's a very special person. She's associated with the Lake Area United Way, and she's here to bring us all sorts of great information about programs and other ways that other entities in the region help bring services to not only Gary residents, but those throughout Lake County, Indiana. In addition to that, we have a representative from the NAACP, lady who I've gotten to know pretty well over the last few years and who I know as a steward of the community, and certainly she's got wonderful information relative to the complete census count today, and that's Darian Collins from the NAACP. And also is a young lady who joined us last week who represents the Edgewater Health Systems for Balanced Living, Miss Nina Johnson. I'm certain that she's going to share relevant information with us based on the census, as well as anything else that she deems necessary for us to know. Unfortunately, I do not have the names of a few guests that I'm extremely proud to have here, and just pleased that they've taken time out of their busy summer schedules to join us. And that are some of the younger citizens of the community. Two of them joined us last week. Again, I don't want to butcher their names, but I'm certain that they'll have an opportunity to be presented here before you all. Thank you all for coming as well. Since the COVID-19 virus arrived in Lake County, Indiana, and specifically in Gary, our fight to protect the community has taken many twists and turns. The virus and its impact is something that we continue to monitor on a daily basis, and we've discovered it's completely unpredictable. To that end, for months, we've experienced what we saw as double-digit increases practically on a daily basis right here within our own community, and it certainly goes along with the amount of positive cases of COVID-19 that we've realized also. Somewhere right around June the 6th, we started to notice a trending down of sorts with those numbers, and for a significant period of time, we realized single-digit increases on a daily basis. And at that particular point, we were certainly not under the impression that we were out of the woods, if you would say, but certainly we were satisfied with the efforts, because in a lot of ways it meant that our message was resonating with the citizens. The message of safe and social distancing, the application or the wearing of masks, and the acknowledgement that this virus could spread to certain segments of the population a little bit faster than it could others. In the past week, had a little bit different experience. In fact, over the last few days, we've realized double-digit increases again, and Dr. Walker will probably speak a little bit more to that. But we understand that I believe today we realized 19 cases, additional cases, 16 new cases of COVID-19 that have spiked just today. What does all that mean? It means that my team and I have more work to do, and we certainly have more discussions to have in an effort to keep the community at large safe. Today, I'm ordering or mandating that all residents within the city of Gary don masks when you are present in indoor facilities, or even outdoors if you are in the company of persons who you are not necessarily familiar with, or there's situations where you have to come into close contact. CDC has also issued a similar mandate as late as last week, mandating that all citizens in the United States, in this nation, strongly encouraging them to don mask. We're going to follow suit, because what's been proven up to this point, even though that we don't know everything about it, we've certainly realized that wearing masks helps to reduce the transmission of the virus, and we've certainly learned that this virus can be transmitted airborne wise. And so to that extent, the order will be effective immediately, but more importantly, Monday morning, we expect that everyone in the community certainly will have had this information and will adhere to it just as they have in the past. The challenge there is that, as many of you have recognized over the last few days, many of our beaches and outdoor parks that are adjacent to our community have decided to close their operations. I certainly understand that, and I would never second guess a leader of community who seeks to provide the best information and the best protection for its residents. We see our community as one that's slightly different. However, the need to be safe is just as important as it is in the other community, particularly when other beaches and recreational areas close. It's reasonable to expect that we will see an influx of out-of-state and out-of-town visitors at our beaches, and the likely response that most or some would have is that we should absolutely shut down our beaches as well. One of the benefits we have is that in our community we have the largest area span for our beaches, and to that extent, myself, Dr. Walker, and other members of our team have observed the activity at the beaches, and we're fairly confident that because of the 6 or 7 mile stretch of beach area, open area that we have, that if persons adhere to these guidelines and are responsible, that there is an opportunity for them to social distance properly. When you see congregations of folks, and they're typically between 5 and 10, those, what we've discovered, are familial units, and one of the things that we're most pleased with is that individual familial units are adhering to the recommendations and the encouragement of this administration, and certainly our health inspector, Dr. Walker, to practice social distancing. So at this point, we believe that the data and the evidence that we've seen does not warrant or suggest that we have to shut the beach down. But let me make it emphatically clear, if that changes at any particular point, I will not hesitate to shut down our beaches and parks, or any area that we feel could be conducive to the further spread of the virus. That concludes about the most of my presentation, but at this particular time, I'm going to invite Dr. Walker up, who will certainly share more specific relative information to exactly what's happening with our numbers and how we can continue to stay safe. Dr. Walker.
Thank you, Mayor. I appreciate your leadership. Thank you for having me here today. We want to welcome Ms. Doherty, Ms. Collins, Ms. Johnson, our youth leadership here today. That's always my favorite part, having the youth here. I'm going to be brief today. I'm first going to go over the numbers. I'm going to go over a couple of areas that I think are most important in our fight against this COVID virus. So in Indiana, first I'll start with the Indiana numbers, which I always do. We've had a total of 54,813 positive cases so far since this pandemic has begun. Today we have 747 new cases and 8 deaths in the state of Indiana, and 2,610 total deaths in the state of Indiana. In the county of Lake, which we reside, we now have had 5,983 cases, and in Gary, Indiana, we now have a total of 908 cases, no new deaths, but as the mayor spoke of earlier, we had 16 positives today. So over the last 7 days, we've seen a couple of spikes. We've seen a 20 and we've seen a 16. Because of our smaller population, we expect these fluctuations up and down. But we do recognize there's a trend. So first, let me start by commending the citizens of Gary, because we live here and we observe. And it looks like the citizens of Gary have done a really good job at wearing masks and social distancing. I've been in businesses, restaurants, and I think that is why we have seen the progress we had seen as our numbers had gone down under single digits. And quite honestly, in the city of Gary, we don't live in a bubble. We are influenced by national trends. We've been influenced by our regional trends, and that, I believe, is why we're seeing those upticks now. And we need to respond to it appropriately. So we had conversations, our team, and we decided to now, the mayor has decided to give a mask mandate, which I am extremely in support of. That should be a national trend, and we look for that leadership so that we can see this. Because we don't have hard borders, because we don't live in a bubble, what happens in Alabama, what happens in Georgia affects us here. So if we wear those masks, we can help to mitigate those risks. A couple other things, the mayor spoke about our beaches. And anybody that's a beachgoer knows that our mayor frequents the beach. I frequent the beach in terms of I'm constantly out there, when I do my runs, and I'm observing. And like the mayor said, we have done a decent job. I've noticed families congregate together, social distancing between others, but the beach is a major concern for me as a health official. I've seen other areas, local areas, West Beach, for instance, not necessarily adhering to those guidelines. So the mayor and I have discussed it, and I will make recommendations if I see that the beaches are not going in a manner in which I think is conducive to our community. A couple of weeks ago, I met with 8 school systems that reside in the city of Gary. They gave us their back-to-school plans. And based on their resources. So that's another major area of concern to me. And I think that all of those plans are fluid, and they'll continue to communicate with their parents and the students to see what their plans are as they head back to school. Also, youth sports is particularly concerning to me. I do recommend the non-contact youth sports, whether it be track, cross country, tennis, golf, as long as they're adhering to social distancing. I have major concerns about those contact sports that include basketball, soccer, and football, as I do not see how there can be any social distancing at all in those contact sports. And so I highly recommend that all parents consider before sending their children to those contact sports, as they will be able to spread virus and be able to bring that home. Just consider this, Hassan White reported that since he entered the bubble in Orlando, Florida, he's had 20 COVID tests since the time he's entered the bubble. I would ask those parents, how many tests have your children had since they've started their youth sports? So as I bring those information to you, once again, I just want to commend the citizens of Gary. I think we've done an absolutely wonderful job so far, but the national trends do tell us that we're going to see uptick coming not only in late fall, but then as you would expect increases in the late summer. We're seeing increases, and then you would expect increases in the fall typically anyway. So I think the mask mandate is going to be extremely important to help protect us. Social distancing is going to be extremely important to protect us. And I think if we all do our part, we can help to mitigate those risks and keep your family members safe. The way I think about it is you wear a mask for your family members, and your family members wear a mask for you. Thank you so much for your time.
Good morning, Mayor. Thank you for having me. I really appreciate it. So I appreciate the opportunity to come and talk to Gary residents about the somewhat new work that Lake Erie United Way has been doing. And as it turns out, the work that we've been doing is completely COVID related. The needs are amplified. So a few years ago, we took a step back, knew that we wanted to do new work, more meaningful work, and we went out into the community, talked to hundreds of Lake County residents, including many from Gary. And what the community told us was that they wanted us to focus on helping them access resources, including jobs, better paying jobs, and childcare. With COVID, we know that there are many amplified needs for those basic necessities, as well as accessing maybe a new job because you lost it due to a furlough or a closing, and you need to earn more. To live in Lake County and have 2 children, you have to earn about $70,000 in your household to afford those basic necessities. So let me tell you about a couple of resources that are really important. We've spent a couple of years building an online searchable directory called Resource Roundup. The URL on that is www.resourceroundup.com. We've got about 400 agencies that are updating their information regularly. You can go into the site, you can choose a category. Maybe you're looking for food assistance. Maybe you're looking for burial assistance. Maybe you're looking for childcare. You can search that database and find all of the providers that are in your immediate area that may offer that service and or assistance. So when COVID hit, Lake Area United Way, since March, put about it'll be about 1.7 million after this week dollars into the community, investing in those agencies where we know it's easy for you to access. You know, Catholic Charities, Salvation Army are the 2 biggest that come to mind, the Food Bank of Northwest Indiana, and some others, so that families in particular who were displaced from work could access those organizations and get assistance. What we know from that database and what people are searching for, the 3 top needs are, and in this order, food, rent, and utility assistance, rent or mortgage. Those continue to be the top needs, and the organizations that you'll find in that site can often help different individuals. And at any time, you can always reach out to Lake Area United Way at lauw.org. We've done a lot of outreach on Facebook, trying to connect with families who might be looking for assistance. So we call that our emergency phase. That's what's happening, you know, in the urgent time with COVID. We know that we're going to have to be there for families during the recovery phases. So the 2 areas where the community told us they needed some bridges, some pathways, just some help accessing resources that are out there are around livable wage jobs and childcare. So we invested in a family navigator. Her name is Talisa Rogers Hall. She's from the community. She grew up in East Chicago. She's worked at various nonprofit organizations in Lake County, as well as workforce development organizations. So she's got a great background. She meets with families, meets them where they are, whether it's in the community. Of course, COVID's changing a little bit of that. She's doing a lot of cell phone calls and Zoom and texting. But she meets with a family, tries to understand what their aspirations are in terms of their career, and she will get them connected to different resources. Families told us they're not networked. They don't know where the opportunities are. And there are opportunities in our community, and we're investing in ways to help families access those opportunities. So I highly recommend reaching out to Talisa Rogers Hall at Lake Area United Way. I know they've got her email address posted and will be on the site. The other resource that I think is really important in terms of that recovery phase, and of course not knowing what the impact of going back to school is going to be, we know that parents are going to need backup childcare. And we know that childcare is very expensive. In Lake County, quality childcare can cost a family between $8,000 and $10,000 per child. That care is important because it prepares the child for kindergarten. You know, it ensures their success, but it's out of reach for a lot of families. So Lake Area United Way is investing in strategies that make it accessible and more affordable for families. We are partnering already with the YMCA, which in their different locations, they're offering backup childcare. We're offering subsidies to working families, as well as pulling a network together right now. We're actually working on this as we speak, of different providers, whether they're childcare providers, out-of-school care providers, school systems, and we're looking at how we can create this network and access resources. So if you're in the need for childcare, please reach out to Lake Erie United Way, because it's an important investment, one that we know impacts 2 generations, and we want people to take advantage of the resources that we have available. The one last thing that I forgot to tell you about when I was talking about, basic needs, with COVID, a worry that we've had all along is what happens when the moratorium on eviction ends. Right now it's scheduled to end at the end of July. They have announced a rental assistance program, and I'm going to give you the URL that you can go online and apply, so that it will help you up to $2,000 with past due rent and deposits, etc. So that website is ihcda.gov/submit. You go to that URL, you'll be able to fill out an online application and get assistance. And if you can't do that on your own, reach out to Lake Erie United Way and we'll help you get connected. Thank you, Mayor. Thank you, everyone.
Good afternoon, everyone. How are you all doing today? First of all, greetings, Mayor. Thank you for inviting me, Dr. Walker, and everyone here in the room. I'm really happy that I could be here today. And so I wear a number of hats, but one of my hats is working at Edgewater Health. I'd like to thank Dr. Danita Johnson-Hughes for allowing all of us here as staff to be here to help to volunteer. I know earlier we heard the mayor and also Dr. Walker talking about the COVID testing. I have to cover this because I feel like this is something that is really beneficial for us, for our citizens. And so just for the citizens of Gary, just so you know, Edgewater Health will be offering COVID testing, and the testing dates will be July the 27th, July the 28th, and also July the 29th. And if you'd like to schedule an appointment for COVID testing at Edgewater Health, that number would be 219-885-4264. So I just want to make sure that everyone in Gary is tested. We've heard that children are starting school and young adults, and we want to make sure that they are safe. So anything that we can give our community is very beneficial. And today I am here for the citizens of Gary to talk to you. And some of you are like, I'm so tired of hearing about the census. Well, you know what? We need to hear about the census, because the census is very important, because if it were not for the census, we would not get the federal dollars it takes. You've heard this morning the talk of like these community resources. We would not have the community resources that are available to us for the fire department. It could be for different services, Head Start, hospitals, health care. Those are things that are really needed. But now I'm going to hit home to some people right now, and that's for the children, the older people. I mean, sometimes if you can say, well, hey, you know, if you want to go to Head Start and you can't go to Head Start because Head Start doesn't have the funding. Why doesn't it? Because you did not complete your census. And then for the older people, now I know somebody saw me on television or either on Facebook the other day, and they were saying, hey, didn't you say we won't have Meals on Wheels? Wait a minute, what is she saying? Maybe I need to pay attention. So what I'm saying to you is you need to complete your census. And also, when you're sick, where are you going to go? The hospital, the federally qualified health centers. That's where you're going to go. But how can you go if the hospital does not exist? And then another thing, if you're going to go on the bus and you are handicapped or you're disabled, how can you go on the bus and you're disabled if you can't even, there's no ramp to go on to? So those are things that the census pay for. So I cannot stress to you enough how important it is, because we definitely want those dollars. And I know some of you may be tired of hearing that. census, that what we've done is we've all volunteered. We've volunteered for different committees and things like that because we care. And so I definitely have to thank be able to come up with creative ideas so that we can try to get people involved. And so we definitely appreciate our mayor for giving us the opportunity to do this. He's even complete your census. And then, just in case you're wondering how, get your pen handy. If you can't find a pen, find a pencil. If you can't find a pencil, find a crayon. Yes, I did say a crayon. And you can write this number down. The number is 844-330-20. At this time, I'd like to introduce Deshaun Thornton, who is an employee at Edgewater Health, and he'd like to say a few words. Deshaun, would you like to come forward?
Good afternoon. I just wanted to say, first and foremost, thank the Mayor for giving me this opportunity to speak. And my name is Deshaun. I am a volunteer for the census count, and I'm an employee at Edgewater Health. And I must say that I enjoy working at Edgewater Health and going out into the community with Ms. Nina and Ms. Sandra. And also, I enjoy volunteering for the census count and enlightening the community on why the census is important, and it's a good cause to it. Thank you.
Thank you, Deshaun, for those words. Hi, my name is Darian Collins, and I am the first Vice President of the Gary Branch NAACP, born and raised in Gary, moved away for several years, and moved back because there is no place like home. I love it here. I want to thank the mayor for letting me speak, and I want to thank just everyone here for your care and concern about our community. I am here to represent the NAACP. We sit on the Gary Census Count Committee. And there is a very, very urgent need. And again, you keep saying, why do they keep talking about it? It's important. The decisions that we make today of completing the census or not completing the census are going to impact this community for 10 years. It's not like voting, where if you don't vote in the election this time, you can pick it up in 2 years or 4 years. We're talking about 10 years. And so we need everyone in the community to do the census. Now, the percentage of respondents, the response rate for Gary right now is below 50%. It's below 47% actually. So when I think of that number, every time I see 2 people walking around in the community, my mind says one of those people has not completed their census. Now that's just statistically speaking. And so as we, as volunteers and people who are trying to get people energized to complete the census, energized to respond, I walk around and we all walk around and we look and we see, when we go to the beach and we see 100 people, conceivably 50 of those people have not responded to the census. And so we're urging everyone out there, please respond. That's $2,359 for every resident who responds. And the impact is 10 years. It impacts us in terms of congressional legislation, in terms of education funding, I mean everything that funds our cities, our government, our police department, our fire department, just so many agencies, we depend on that money. And so please respond. Now, one of the events, we've been working some different events. The mayor has had fresh fruit and vegetable giveaways in the month of June. There have also been other activities that have worked with food insecurity. And some of the volunteers, including myself, we've gone out and we've talked to people who have been lining up in the cars. We've social distanced and we've worn our masks and we have asked, do you need help completing your census? We can't ask you, have you completed your census? We can say, would you like to have help completing your census? People have told me no. I have completed my census, and then they've come back to me later and said, I only told you that because I thought that I wouldn't get a box if I said no, I hadn't done my census. If you are in line if you need any kind of social service or social support, or if you're in line for any of these resource events, you're not going to be denied if you haven't completed the census. But what we'd like you to do is say, this event exists because of the census. Let me go and complete my census now so that my community can continue to get the resources for myself and for others. Because again, the impact is 10 years. There is an event tomorrow. There is a collaboration of organizations including St. Timothy Church, the Faith Leaders Organizations, Israel CME Church, the Salvation Army. It starts at 4 o'clock. It is a food and resource giveaway. Again, it's at St. Timothy's Church, 2500 Grant Street in Gary. It is for Gary residents. I believe you do have to show ID. I will be there along with another volunteer from the Gary NAAC youth members, Elena Carey, along with the young man that you just saw, and Miss Nina Johnson from Edgewater. There'll be a lot of us there, and we're going to be canvassing everybody in the park to say, do you need help completing your census? If you're one of those people that says, yes, mine is done, then I'm going to ask you to go back to your family members, to your friends, not only in Gary, but all across the country. Have you completed your census? Again, thank you, Mayor. Thank you, Lisa Doherty and Lake Area United Way, for everything that you do. Thank you, Dr. Roland Walker. Thank you, Mike Gonzalez. Thank you, everyone who serves the community of Gary.
And so I told you that we'd have really great presentations, and I thank you all. You know, I'm slightly embarrassed when I hear all of you thank me for the opportunity to be here. First of all, it should be in the reverse. You know, this is all of our City Hall. Everyone's welcome every day. But equally important, it's imperative and it's pretty evident that in order to achieve the greatest results, it has to be a collaborative effort. And not just from persons in Gary, as we've saw Lisa and some of the younger people who have joined us also. In fact, if you guys want to come up and let your friends see you, I think that'd be great, because you can encourage them to participate as well. But most of all, I think the thanks should come from right here at City Hall, because we thank you all for coming up and being a part of what we do every day, because it's you who are going to continue the work in the future. And so if we'd like to introduce yourselves, come on up and say your name for a second, please.
Hi, my name is Sandra Campos, and I'm from Edgewater Health.
Thank you. And sir?
I'm Javier Cardona from Edgewater Health.
Thank you. Thank you. Thank you both. And the young lady, she's a little bashful today. Are you going to come up? Okay, we're going to get you next time, though. So, Javier and Deshaun didn't want to come up. It takes me a few times, so please don't be offended by that. They didn't want to come up last week either, but now you see Deshaun's making presentations, and so again, it's just a joy to have you all here, and it gives me the encouragement that I need to continue to try to make the type of strides that are necessary in this community, because, as I said, it benefits everybody. In closing, I just say that these days there's a lot going on in the city of Gary. As you know, we're certainly facing issues that have spawned from national events that deal with policing and police reform. We are facing a global pandemic, and you know, with that, there's just so much going on. But the thing that sort of makes me feel confident and gives me just a little bit more hope and belief that we are making positive strides is the fact that persons like the ones that you've just met continue to come. We continue to hear from members of the community, and everyone's starting to pitch in to do what we call Reimagine Gary. And so to that extent, I just have one final word to say, or maybe a couple, as everyone who spoke prior to me coming back up expressed the importance of the census. I too want to reiterate it, and we have until October to complete our portions of it, so don't be embarrassed. Starting September the 1st, persons will be knocking on doors to target those folks who haven't completed the form. I'm not exactly sure of the time frame that's associated with this next statement, but if your concern is that the information you provide is going to lead to someone else knocking on your door looking for you or trying to obtain additional information from you, that's simply not the case. The information that's collected in this census will not be available, and this is statutory, this is the law, will not be available for, how many years is that, Nina? Quite a few. Yeah, pretty close, and I forget as well. But the point is that this information is strictly used for the purposes of providing a complete count for communities, but as expressed by the folks earlier, to ensure that all communities receive the necessary funding they need in order to provide services for the citizens of Gary or for citizens of the United States. And to that end, as I always end, I want to remind you that if we remain patient and we remain calm, as we have up to this point, we can and will get through this together. Thank you.